50 years, and I was only the second male patient he had ever encountered that had these symptoms. I'm Mathew Knowles. My background, I'm from Gaston, Alabama. I call myself sometimes a country boy because I grew up on a dirt road, moved to Houston, Texas, got this amazing job with Xerox. In the 80s, Xerox Medical Systems was the gold standard for breast cancer detection. My wife had bought some new t-shirts, white t-shirts for me, and imagine a white sheet of paper and you had a red pen and you had maybe 4 or 5 dots on it. And I said, maybe it's something to do with these shirts, t-shirts that my wife bought. And then the third day, I asked her, because it was in the same spot, a different t-shirt, and I said, I keep seeing these black dots of blood. And she says, I cleaned the sheets the last couple of days and there were these black dots of blood on your side of the bed. In our training in the 80s, there was one day that we had on male breast cancer. And I remember that this discharge was one of the signs of what I call male chest cancer or breast cancer. And so I immediately called my referring physician. So I said, I need to get a mammogram. We got one immediately, like the next day, and then we got a biopsy. And then a few days later, I had surgery and had a mastectomy. Just before surgery, my surgeon said, who was an amazing surgeon, well, Knowles, there's one other test that I want to get, but you're going to be fine. You don't have to worry about it. After surgery, it came back that I was BRCA2 mutated. When I look at my family history, on my father's side, 4 of his brothers died of prostate cancer. My mother's sister died of breast cancer, and my mother's sister, my aunt, 2 of her daughters died of breast cancer. Because I know my family history, I do the things I'm supposed to do. And that's why it's so critical, because it gives you an opportunity to make the lifestyle change. The concern about obesity, the concern about exercise, healthy eating. I've changed my life in reduction of alcohol. And it's a positive lifestyle change for me. I've lost 35 pounds and look forward to losing another 10. In a way, it's been a blessing as well for me. Early detection is the key to all of this. I have so much gratitude that I was diagnosed stage 1A. He or she that finds anything early have a greater, better outcome. And so if I know that I have a family history, and if I know that there's tools available like genetic testing, and if I can get that information, then I want to get that early. When I look at cancer in the Black community, all forms of cancer, I'm not just talking breast cancer, but all forms of cancer. And we look at the numbers again for men, Black men, and we look at the number for Black women, the mortality rate of breast cancer, then it's very evident and it's very obvious. Early detection is the key for and critical and important for the Black community. I'm doing good. Day by day, I feel stronger. And I think I'm giving this opportunity to share my experience. And hopefully it helps others. It helps them to understand. It helps them to survive. I would like to talk to our legislative body. We could put an end to cancer as we know it today. And we can give opportunities and hope and come up with different treatments. Please, take this serious. We need the dollars for research today, not tomorrow, today.